Hi moms, it's Dr. Tim. In this video, we're going to talk about postpartum rejuvenation, more commonly called a mommy makeover. We'll cover what it is, how it works, how it compares to similar procedures, and what you can expect during recovery. Kids are incredible, but they cause significant changes in your body. Most commonly, these changes are laxity of the abdominal wall, called diastasis recti, extra skin on the stomach and breasts, and lastly, a decrease in the volume of breast tissue. Everyone's goals are different since everyone tolerates childbearing differently, but most patients are interested in a combination of procedures for the following concerns: breast volume, nipple position, stomach shape, love handles, and buttocks. But before we talk about surgery, let's talk about your family plan. A tummy tuck, for example, may not be advisable if you think you are going to have more children. Now let's take a deeper dive and look at a couple of patients that have had their mommy makeover. This young mother, after having a few kiddos, was all done with her family planning and ready to take back her old body. In order to do so, we discussed a breast lift, tummy tuck, liposuction of her back, flanks, and thighs, and we were also able to use some of her own fat to be able to further enhance the contours through her hip dips. Here you can see at 2 months that she's got a beautiful hourglass figure, athletic highlights, and no visible scars. This 52-year-old mother of 2 was interested in rejuvenating her whole body. What we discussed was to address the areas that have been directly impacted from having children. We discussed doing a breast lift along with an implant exchange, an abdominoplasty to be able to tighten up those stomach muscles and get rid of the fat and skin from the lower stomach, and liposuction to smooth out her love handles. Here you can see her at 9 months. We've been able to smooth out her stomach, smooth out her flanks, and give her breasts an overall much more lifted, youthful appearance. And the patient could not be happier. Recovery after your mommy makeover is about 1 week. You're going to receive some local pain medicine that lasts for about 2 to 3 days and helps to keep you nice and comfy. Your pain medications during that first week include a combination that we call multimodal therapy that allows you to be comfortable without being nauseous and groggy and constipated. You'll be able to do cardio after 2 weeks, heavy lifting after 4 weeks, but I think we needed to spend a little bit of time talking about special considerations depending on the age of your children. You will need help after your surgery if you have young kids. This depends on the age of your kiddos, but ultimately you need to make sure that you set yourself up for success. The other consideration is that if you have a big date, vacation, family reunion, or anything else coming up, particularly if you need to be fitted for a dress or gown or anything like that, that we would recommend having surgery about 8 to 12 weeks prior to your big date. So that way, when that time comes, you get to focus 100% on your family. Depending on whatever your goals are, I'd love the opportunity to meet with you, answer questions, and come up with your unique mommy makeover. We look forward to meeting you.